Hello everyone, my name is Manal Azzi and I am the head of the global team on occupational safety and health here at the International Labour Organization, the ILO. We are based in the headquarters, our headquarters are in Geneva. Today, I would like to share a snapshot of what the ILO and its constituents are doing on occupational safety and health. The ILO was founded in 1919 and is the first and oldest specialized agency of the United Nations. The ILO is the only what we call a tripartite UN agency with governments, workers, and employer organizations in its governance structure. The mission of the ILO is to promote decent work, enhance social protection, and strengthen dialogue on work-related issues. The ILO produces international labor standards, which include legally binding conventions ratified by its member states and supported by a whole strong supervisory mechanisms for the follow-up on the implementation of these conventions. What we do at the ILO on occupational safety and health covers a range of hazards and exposure areas, such as chemicals, biologicals, ergonomics, physical hazards, and psychosocial risks, including issues related to violence and harassment in the workplace. The work on OSH is obviously very multidisciplinary, from occupational medicine and hygiene to policy and management and public health, among many others. We also work on sector-specific OSH issues, with sectors such as mining and agriculture having very particular risks, for example. There are also a wide range of cross-cutting considerations with direct implications on occupational safety and health, such as gender, migrant work, the informal economy, and micro, small, medium enterprises. We need to take all of these issues into consideration because they also relate to other concerns, such as emergency preparedness and digitalization and other novelties that are coming up all the time. In June of 2022, the International Labour Conference made the historic decision to include a safe and healthy working environment in the ILO's framework of fundamental principles and rights at work. Therefore, this issue joined the existing fundamental principles and rights, which include freedom of association and the effective recognition of the right to collective bargaining, the elimination of all forms of forced or compulsory labor, the effective abolition of child labor, and the elimination of discrimination in respect of employment and occupation. With this major decision, the Occupational Safety and Health Conventions number 155 and the Promotional Framework for Occupational Safety and Health number 187 were designated as fundamental conventions. Therefore, all member states of the ILO must work toward promoting, respecting, and realizing their provisions, regardless of their ratification status. Follow-up by member states will also be required through the form of annual review reports, global reports, and development cooperation projects. Following on from this decision, the governing body has requested the office to prepare a new global occupational safety and health strategy, being proposed now for the years 2024 to 2030. This proposal includes a strategy with the overarching goal of progressively promoting, respecting, and realizing the fundamental right to a safe and healthy working environment worldwide. Ultimately, this will help decrease workplace fatalities, injuries, and diseases. The two fundamental OSH Conventions, number 155 and number 187, are at the core of the ILO's normative framework on OSH, providing complementary and systems approach to managing safety and health at work. The conventions describe action to be taken both at the national level, such as the establishment of a national OSH policy and program and strengthening all the elements that make up a national system, but also these conventions set out the requirements at the level of the enterprise, or what we call the undertaking, and they call for arrangements for cooperation between employers and workers and their representatives. As we can see in this image, the two fundamental conventions are just two of the many standards of the ILO on occupational safety and health. Other conventions cover risk-specific or sector-specific concerns, and some are designed to protect specific groups of vulnerable workers. New standards are also already on the agenda for the ILO for the next decade. These include a potential new instrument on biological hazards, which will be discussed in the next 2 years in 2024 and 2025. There are plans for also new technical guidelines on chemical hazards, as well as a possibly new instrument on chemicals. In addition to this, there will be guidelines on human factors and ergonomics and a possible new instrument on guarding of machinery. These are our plans for the next 10 years. Another prominent feature of the ILO's work has been the development of ILO codes of practice and guidelines around occupational safety and health. ILO codes of practice are generally tripartitely negotiated. They are neither legally binding nor replace national laws and regulations, but they provide very good guidance as to what is required and to be done to meet acceptable standards of practice, including those required by regulations. Since they were introduced in the 1950s, they've provided OSH guidance in various economic sectors, such as we can see in construction, open cast mines, coal mines, iron and steel industries, non-ferrous metals industries, agriculture, shipbuilding, ship repairing, and forestry, among many others. These codes of practice also set out guidance on protecting workers against various hazards. These could be radiation, lasers, visual display units, chemicals, asbestos, and airborne substances, among many others. There is also an important ILO code of practice on recording and notification of occupational accidents and work-related diseases. This is a document that we get requests from around the world to guide people in harmonizing the way they record and report on occupational accidents and diseases. Recent codes of practice on OSH include one on OSH in textiles. This was adopted very recently, so it was really on textiles, clothing, leather, and footwear. Another one was being updated on safety and health conditions in construction. This is one of the most recent codes of practice as well. Furthermore, the ILO produces guidelines that are also the outcome documents of tripartite meetings of experts and debate negotiations. The two key ones that are related to safety and health are the guidelines on OSH management system, the ILO OSH 2001, which is quite a famous document and renowned worldwide, and the ethical guidelines for workers' health surveillance. We are also quite proud of the recent new guidelines on biological hazards in the working environment that were adopted last year. Further to all of this, the ILO promotes the strengthening and establishment of occupational safety and health management systems. This is, of course, based on the guidelines we just mentioned. These guidelines act as a practical tool for assisting organizations and competent institutions as a means of achieving continual improvement in occupational safety and health performance. The ILO recently produced an online toolkit on OSH management systems with information on specific risks. At the ILO, we promote awareness and advocacy around occupational safety and health, and we use various platforms. One of these platforms is the World Congress on Safety and Health at Work, which is held every 3 years, and the World Day for Safety and Health at Work, which is held every 28 April every year. This year's World Congress in 2023 is co-organized by the ILO and will be hosted in Sydney, Australia. We encourage everyone to join us there in November 2023. As for the World Day for Safety and Health at Work of this year, which is coming up very soon at the end of April, the theme is really the focus on the idea of a safe and healthy working environment that has been recognized as a fundamental principle and right at work. We have now a lot of informative and promotional products that have been produced and events already being planned that will take place around the world. I invite you again to join us for the global webinar on promoting the World Day for Safety and Health this 28 April, which will be held online, hosted by the ILO. The ILO has focused on a variety of themes for Safe Day over the past years, such as promoting a preventative safety culture, strengthening occupational safety and health systems, responding to pandemics, in addition to issues related to OSH and the changing world of work. I also thought it would be a good idea to show a little snapshot of some of the recent publications and materials that we've been producing around safety and health and other topics in the ILO. Some of these are chemicals publications, violence and harassment publications. Some of our publications are focused on mental health and OSH, and some actually look into and shed light on small, medium-sized enterprises and their particular struggles, challenges, and opportunities in dealing with safety and health. A major recent achievement, after years in the making, has been the publication of diagnostic and exposure criteria for occupational diseases, providing guidance notes for the diseases lists that are present in the ILO list of occupational diseases. This list was obviously last revised in 2010 and hopefully will be revised very soon. The ILO, of course, does not work alone. We are engaged in a number of interagency groups, collaborative efforts, and international fora related to occupational safety and health. These include work with other stakeholders on the global sound management of chemicals and waste, as we play a key role in the Inter-Organization Program for the Sound Management of Chemicals, the IOMC. The ILO is also active in the UN Interagency Task Force on the prevention of non-communicable diseases, and we work very regularly with the International Atomic Energy Agency, in addition to a variety of other networks where we are very present. To complement our regulatory work, we also have a strong development cooperation arm, overseeing a number of global, regional, and national projects. To give you a few examples, in North Africa, we are managing a project to improve safety and health for workers in vulnerable conditions in Algeria, Morocco, and Tunisia. As for the Asia and Pacific region, we have OSH projects in several countries, including a project on implementing OSH standards in Lao People's Democratic Republic and a project on OSH in the coffee supply chain. In Myanmar, the ILO is managing a project on improving OSH in the garment and ginger supply chains, as well as a broad project to build a promotional framework for OSH at the national level. In the Philippines and Indonesia, an ILO project is only focusing on improving worker rights in rural sectors with a specific focus on women. The ILO also has a project in the Philippines focused on helping micro, small, medium enterprises bring back jobs safely following the COVID-19 pandemic. I think I've now made a quick round of the ILO's global mandate on occupational safety and health, and hope that this will lead to continued collaboration with everyone working towards making our workplaces healthier and safer. Thank you.